In the echocardiographic study of a patient with pulmonary hypertension, the abnormal septal motion observed in the parasternal view suggests significant right ventricular overload. In the apical four-chamber view, severe right ventricular enlargement raises suspicion for pulmonary thromboembolism. However, the classic McConnell's sign, typically indicative of pulmonary embolism, is absent. Instead, we observe a pattern of hypokinesia in the mid to apical segments of the right ventricular free wall, while the basal segments remain hyper-contractile. This phenomenon represents a reverse McConnell's signs, which, though rare, can also be associated with pulmonary embolism. In the short axis view, the main pulmonary artery and the proximal branches are clearly depicted. Is there anything wrong here? A large hypoechoic mass is observed in the proximal right pulmonary artery. While echocardiography is valuable for detecting right heart strain, it has a low sensitivity for detecting clots. The visualization of clots in echocardiography reports varies widely, from about 1.8% to 18%. Therefore, a thorough assessment of the right atrium, right ventricle, and main pulmonary artery and its branches, along with the evaluation of the IVC in patients with right ventricular enlargement and pulmonary hypertension, is highly recommended. Let's delve into the transesophageal echocardiographic view. We observe a severely hypokinetic right ventricular apex, while the basal segments of the right ventricle maintain preserved motion. This pattern represents a paradoxical or reversed McConnell sign. This view reveals the proximal right pulmonary artery, which is occupied by a large crescentic hypoechoic mass. This upper esophageal view also reveals the large mass consistent with a clot in the proximal right pulmonary artery. The 3D echo further confirms these findings. In summary, although echocardiography may have limited sensitivity for detecting pulmonary thromboembolism, and a normal echo does not rule it out, a detailed echocardiographic study can still be invaluable in certain cases.